Western Sydney's a great place. It's a place of immense diversity, and it's also a place of tremendous change. But Western Sydney also has its challenges: childhood obesity, an ageing population, and mental health issues. The Better West strategic priorities identify the most important needs of our population in the near term, as well as the resources that we have available in order to address those needs.
The Healthy People priority promotes a good start for the first 5 years of life. If we can reduce childhood obesity, it really sets that person up for life so that they can reduce the chronic diseases that can occur later in life, as well as just feeling better about themselves.
The best way to treat mental health issues will be to treat them in the community. We'll have to work with the family and the carers so that patients with mental health issues are supported well so that they don't need admissions in hospital.
We will ensure that people living with a mental illness within our community have clear and ready access to services that they require when they require it.
Exceptional people require an exceptional culture to thrive.
We really want to develop them so they can reach their full potential, focus on their well-being and care for them. And if we can do that, we can really care for our patients in the best way possible.
To have the staff friendly so that the patients are relaxed, I think that has a lot to do with improving your health. So therefore, I think a lot of concentration needs to go on to the staff for training for public relations with your patients.
We want to be a centre for learning excellence, to focus on our clinical leaders, to really develop their skills, to make great decisions.
Exceptional people create a collegiate environment. They'll have a high degree of emotional and social intelligence. They will be engaged and have a vision for the organisation, and they will be constantly striving to think outside the box.
The integrated research, education and clinical care priority is all about making research and education an integral part of our service in the pursuit of excellence in clinical care.
It's about taking our partnerships with the universities and the research institutes to a new level and really integrating healthcare, education and research for the health of our community.
Patient experience matters. It's about communicating better, it's about being open, and it's about being accountable. We will work with our patients, our carers and our families towards greater health literacy in Western Sydney.
When you have an empowered patient with whom you're going to partner, it's a journey you take together. The results are fantastic and the experience for them is positive.
Our Spending Wisely strategic priority is not just about what we spend today in our hospitals, but how we invest in the future of the health of the population in Western Sydney. Data is critical to spending wisely. We're tracking every piece of activity that happens from the moment someone walks in the front door of emergency department, and even when we're talking to our GP partners. It's all about providing a better service going forward.
A modern health system really relies on vast amounts of information to inform clinicians, but also to help us plan how we do things in the future. We're investing in infrastructure, investing in new systems and technology, and investing in people.
We're going to have data scientists as well as clinicians looking at all the information that we're gathering using advanced data techniques.
The redevelopment embodies all of the strategic priorities for Western Sydney Local Health District and is really focused on designing a flexible workspace that engages and empowers patients as well as staff.
The strategic priorities speak to a vision for the way in which this organisation needs to evolve if we are going to be relevant and effective in delivering the best care we possibly can to this population.